All right, and Moon is on their way as well. Um, and I see that the number of attendees has slowed to a trickle. So I'll get us kicked off while Moon gets in the room. Thank you all for joining us today. We are very excited. Hep B United's very excited to be really setting up this space and time for the UC Davis Comprehensive Cancer Center to come in and share some really, really great materials that they've put together on hepatitis B that are both in English and in some other languages. The title of today's webinar, as you can see on the screen, is A Buffet of Hep B Resources. And we landed on this one, it's a little tongue-in-cheek, but we landed on this one because there really is just a buffet, a potluck, a smorgasbord of resources that are going to be gone over today. Mostly from the UC Davis Health crew, but we also have some of our own from HBF to throw in there and make sure folks have a chance to see. Just checking my panelists. Nope, we're still waiting. Excuse me. We're trying to get our like featured speaker, Dr. Chen, in the room. We're not sure what's going on with his panelist invite. So I think while we have that go on, I'll go through here. This is our list of speakers, and I'm actually going to come back and have folks introduce themselves here at the beginning instead of before each of their individual pieces. A little about who's hosting this webinar, though, and Moon will talk. Moon and his team will talk more about the UC Davis Comprehensive Cancer Center. But if you've not been on one of our webinars, welcome. We're Hep B United. We are a national coalition. I like to say we're a national coalition of coalitions, consisting of state and local organizations and coalitions that are really focused on hepatitis B, whether that is focused on the issue of hepatitis B itself or working in a community that is disparately impacted. So a lot of our partners have joined our coalition, having been working in their communities for a long time and working on things like high blood pressure, or diabetes, and then realizing that hepatitis B was also, or seeing an increase in hepatitis B in their space, reached out and really became involved. We have existed for 12 years, and our mission really is to bring folks together to eliminate hepatitis B. And so it is great to be able to raise the awareness of this issue and some of the resources needed to tackle it. So backing up, I want to give our other speakers a chance to introduce themselves. And I do this every time. I start talking and I forget to say who I am. I'm Frank Hood. I'm the director of Hep B United. And as I said, we're a coalition of coalitions, but we are co-chaired by the Hepatitis B Foundation, based in Doylestown, and then APCHO, which is the Association of Asian Pacific Community Health Organizations. And we, like I said, we really focus on hepatitis B. Okay, we're getting Moon in, it seems. Moon, I think we just got you in the room.
Yes.
Hi.
Yes.
So, you know, technology was always going to rear its head at some point. So I just introduced our title, and I had introduced the hepatitis or the Hep B United Coalition. I was going to have your team introduce themselves if you weren't in the room yet, but now you're here. So, yeah.
Well,
Do you need a minute?
Thank you, Frank, and is delighted to be on this webinar. Thank you for making the arrangements. Today we have convened our END, ending the transmission of hepatitis B from the perinatal period throughout the lifespan to you. And I'm going to be just interacting with you, but we are going to be supported by Dr. Eric Chack, who was a hepatologist, and our hepatology director, Dr. Julie Gang, who's our outreach and engagement director, research director for NB, Ms. Bao Her, who's one of our COE specialists and a bilingual bicultural Hmong American, Alex Gorey, and they're going to be presenting, a variety of materials that we have just developed this year because of the new changes of the CDC recommendations about screening for hepatitis B. So Frank, that's my overview.
But no, and that's really exciting. And I was prepping the audience for the fact that we had a lot coming at them today. You said that NB stands for ending the transmission of hepatitis B from the perinatal period throughout the lifespan. Can you talk a little more about kind of how the NB study came to be?
Yes, we're very fortunate to be funded by the U.S. Office of Minority Health starting in July of 2019, and our focus was on Southeast Asians and other Asian Americans who by birth were at greater risk to hepatitis B. And so we did partner with a federally qualified health center, Health and Life, and that coalition, that effort involved screening, prevention, and outreach. And we were focusing on, like I said, people that the CDC identified based upon risk factors, primarily based upon place of birth. But this year, 2023, CDC changed its recommendations to recommend that everyone ages 18 and older be screened for hepatitis B at least once in their lifetime. And so the materials that we have and that we want to feature with you is how that has occurred and how much simpler it is to actually have the potential of eliminating hepatitis B linked liver cancer as a cause of death. And I will tell you that's exciting for me because I see many attributes of hepatitis B similar to smallpox virus. The smallpox, as you know, is the world's first disease eliminated from the face of the world, and it has so many attributes similar to hepatitis, being a virus, being virally transmitted, being the fact that it's very significant in terms of mortality, being ways in which it can be treated, but most importantly, having a vaccine to prevent it. And so that's the idea, and that's why we want to share our new recommendations and how that can really start the momentum of eliminating hepatitis B as a cause of liver cancer.
And I mean, we all work in this space, so we know the impact and rates of liver cancer. But for those who might be joining this webinar, coming from the hepatitis B or other infectious disease space and not understand the total mortality and kind of disastrous nature of liver cancer, can you talk some about those rates and where they have been heading recently?
Yes. In 2010, liver cancer was the world's second leading cause of cancer deaths, right after lung cancer. In 2018, liver cancer got demoted to being only third. So let me just say that the numbers there are while the overall number of cases have increased, but the exciting thing is that because of the tremendous work of community-based organizations, the emphasis on screening, the role of the primary care provider, we have been able to get demoted, which is good in the leading cause of death to be demoted, and now it is the third leading cause of death. And we have the potential to do even further through the universal screening, which Dr. Chak is going to explain. So Eric Chak is a wonderful hepatologist, and he's providing our efforts, and he'll be glad to introduce that topic to us. Eric?
Yeah, so I think when we initially started NB, it was traditionally, as you guys know, based on risk factors. So where someone was born, and maybe where their family was from. So traditionally we would screen Asians or patients from Africa. At least that was based on the main societal guidelines like ASLD and things like that. Recently, this year, there has been a change in that, which was a little, not really a surprise for us, but we did have to pivot, during that time where the CDC has recommended to screen everybody for, again, for hepatitis B. And they recommended a universal screening program. So essentially what that means is I think it actually simplifies things a lot because, whereas before we were trying to find patients or, people who are from certain areas to screen them and, do things with EHR, their last name, things like that. It got very confusing and a little bit muddled sometimes, to be honest with you. Now, the CDC recommendation is a lot more simple. If you're 18 years or older, you should be screened for hepatitis B at least once. And this mirrors what their recommendation has been for hepatitis C and HIV as well. So you're probably familiar, with universal hepatitis C screening and HIV screening. So this will be just hepatitis B following suit. I will say it is an early recommendation. I think it was May that it came out. So the USPSTF, so this is the United States Preventive Services Task Force. This is a society that we kind of look to for, okay, is this going to be something that's covered by insurance? So that's still something that's up in the air, I would say. So even though there's that recommendation from CDC, we don't really know when USPSTF will come on board. I think that they will soon. And, as this recommendation matures, we'll likely see USPSTF come on board. And then we'll be able to do more, aggressive programs to screen patients because we won't be worried about coverage for insurance.
Even without USPSTF having made that transition yet, how has the changes in the recommendations already, have you seen the changes in recommendations already kind of bearing fruit within the health center?
Like I said, it's early, and I have tried actually when the CDC recommendation did come out, I did reach out to our IT and our internal medicine leadership, because those are the people that actually will be screening patients primarily, and that is exactly what they told me, is that since USPSTF has not come on board with the recommendation yet with at least a grade B or higher, for universal screening, then we should hold off. So I haven't seen any fruit yet, but I'm anticipating that fruit. It's the seed has been planted, I'll say. So
all right, no,
yeah.
that's great to hear. And the Hepatitis B Foundation and Hep B United have both put in our kind of nudge of support to USPSTF, being like, hey, this has happened.
Yes.
Your recommendations will have great impact. So did you have resources we wanted to share screen with or bring up right now, or should we move forward to others? I think I saw your head nod.
Yeah, I think I'm starting with that. I don't know, Dr. Chai, if you had any slides you want to show, but I can start off with the slide deck. So I'm going to share my slides, and I'm going to talk a little bit about the materials that we've developed since that universal guideline was released. So let me slideshow. Okay, I'm hoping you see it on.
Yep.
Okay, perfect. So again, my name is Julie, and I'm going to talk a little bit about the materials that have been developed ever since the guidelines have been updated. I want to first start with our community feedback. So internally, our group, led by Dr. Chak, came up with some simple messaging around the universal screening. So we vetted it among our community health educators and our coordinators, just to see which messaging would be the best one that we want to present to the community members. So we came up with two options, option 1 and option 2. And then we also came up with taglines that we were going to attach to our social media campaign. And then we also attached some social media graphics. And on the right-hand side, you can see this is the email that went out to our community advisory board members. So the Cancer Center, we utilized our community advisory board members to get their feedback on which option they thought was best for their community. So they got to choose between option 1 or option 2. And then they also got to choose from tagline 1 and tagline 2. And then we had a slew of social media graphics that they were able to choose from. So it ranged from images of various people, various race and ethnicity, and various things that folks were doing. So we sent this email out to our community advice member. We gave them a couple of weeks to review the materials and give their feedback. So then everyone emailed back and gave their feedback on which messaging they thought was most appropriate for their community and which tagline they liked the best. So based on that, we developed these multilingual posters. So I'm going to show a slew of posters and materials. The first one is this poster. We have materials in the various languages that are just like a single, like English or Hmong or Punjabi, Spanish, Thai, and Vietnamese. But this poster was meant to be for our community clinics. So instead of having just one poster for Hmong, we chose a very simple message that says all adults should be screened for hepatitis B. And then we got it translated into the various languages. So these were translated from our community health educators and from our community partners. And then they were back translated to make sure that these messages were simple enough for the community and at the right health literacy level. And then the second message we include on there is if left untreated, Hep B can damage your liver and even cause liver cancer. So we translated all of that as well. So the first one, I don't know which. I'm going to have a hard time figuring out which language. I think this is in Chinese, the first row. I know this is Vietnamese. This is Hmong. This is Thai, Punjabi, and then in Spanish. And then the last message we had is get screened, call your doctor today. And these were big posters that we left with our community clinic partners. The second thing we did was like I mentioned, we created individual flyers as well. So we began canvassing our catchment area. So the catchment area for UC Davis, this is the area that our community outreach engagement core serves. It's 19 counties, with UC Davis being located in Sacramento. So we went to marketplaces where community members convene. So we went to various marketplaces in Sacramento County. So this is Bao flying out one of our marketplaces. I think this looks like the one on Saucon Boulevard. And this is Alex dropping us some additional flyers here. And then these are 2 Vietnamese magazines that we translated the Vietnamese version to 8 by 11 pages. And we had it running in the Vietnamese newspapers for about 2 weeks. And the Vietnamese newspaper, these 2 are the most popular in our area. And this one serves all the way from Sacramento down to like San Jose, which is not even in our catchment. So we had a really wide reach of audience for this one. And this magazine here served the Sacramento, Stockton, and Modesto area. So this is Sacramento and San Joaquin counties. So we did marketplaces, and these slew right here: Ampla Health, Northern Valley Indian Health, Golden Valley Health, Health and Life Organization, and WellSpace are federally qualified health centers. And between these 1, 2, 3, 4, 5 health centers, they cover about 9 of the counties in our catchment area. So Tehama, Glen, Butte, Colusa, most of the ones that appear. We also provided the flyers to our student-run clinics. So UC Davis has about 10 student-run clinics that provide free primary care to underserved communities in Sacramento County, and they can get the hepatitis B testing for free at the clinic. So we went out to these community clinics and had them put the posters up there as well. And then another component that we added to this campaign was our social media post. So we ran Facebook and Twitter messaging around the hepatitis B campaign. So across Facebook and Twitter, there were over 100 post impressions. So that's the amount of people who actually read the post and viewed the post. So I just did a screenshot of our Facebook one. So this is what we posted on July 28th, and we posted a bunch of our materials as well. And then these are the individual infographic for each language. So this one's the Vietnamese one, and then this one is the English version, and then this one is the Hmong version. So I had mentioned that these were all community tested. So for me, I focused on the Vietnamese community one. So I ran some focus groups with my community members to assess whether the language was appropriate and if the picture was appropriate. Oh, I'm like, something's playing. So this is the radio PSAs. So in addition to the social media, the newspaper, the canvassing and the flyering and the posters, we also has some radio public service announcements. So we reached out to the different in-language cultural radio stations were in their area to have these PSAs. So the PSAs were 30-second clips, and it just had the same messaging as our infographics did. So we reached out to Hmong radio, Punjabi radio, and Spanish radio. And the reason why we chose to focus on these 3 groups with the radio PSAs was that we know from our communities that these three groups really listen to the radio, and they listen to the radio in their in language. And in terms of like the Vietnamese one, we did a newspaper route because a large portion of the Vietnamese community get those two newspapers versus listening to the radio. So we were trying to adapt the way that we deliver the messaging to the communities in the way that that would resonate with them. Is that?
We don't hear anything on our end if you're.
Oh, you don't?
No.
Okay, you don't hear anything on my end. I can hear all the PSA playing.
Oh, okay. No, nothing on our end.
Okay, we can definitely share those PSA messaging if anyone's interested in reaching out to multilingual radios with PSAs. And then lastly, this is the Cancer Center's press release that went out on July 28th. So in addition to the canvassing, our Cancer Center media officer put out this press release to say that we're canvassing in our catchment area, and then just to spread the word about why it's important to get screened, the universal screening, and providing those updates. And then Dr. Chak actually re-recorded this video. So as part of the NB project, we create these 5 to 10 minute videos for medical assistants to go over a whole slew of cancer control and prevention training modules. And this is the hepatitis B one. So we recorded this about 2 years ago before the guidelines changed, and he re-recorded this in June, I think, of this year. So this is the updated hepatitis B video module, and it's a really quick video, 5 minutes and 35 seconds for medical assistants and other primary care staff, just to have a quick update on what the guidelines are and why it's important to get their patients screened for hepatitis B. And this video was actually incorporated into one of the Federal Qualified Health Center's training packets for new staff. So the new staff would watch this video, so they just would be alert that this is something that's coming and something that they should test their patients for. And then I'm going to end on this slide, which brings us up to what Bao and Alex have been working on. So they created some hepatitis B videos, and they're going to share with you the process of creating these videos, and then also share some lessons learned. And then I think there's something in the Q&A. I can stop for questions.
Oh, actually, this question we will make sure to answer at the
Okay.
end. And did just want to note, with your PSAs, you offered that folks can reach out if they're interested in doing those PSAs. Is that so they could use it within their radio markets?
Correct. Yeah. So I don't know why it's showing. I can hear it on my end. I think Alex embedded it. But if you want the video recording or the script of it, I can definitely send it to you, and you can use it for your market if you happen to have a large population of Hmong, Punjabi, or Spanish speakers.
That's great to hear for our audience, just because what was one of the existing sort of PSA around B was part of the No Hepatitis B campaign with CDC, and those PSAs, the contracts kind of allowing those had expired, and so we had actually just recently lost some access to PSAs, and so really thankful to see that these in language ones now exist. We'll make sure to promote them as well. Yeah, let's hear about some more resources. Let's hear about the videos.
Awesome. Okay, I'll share my screen now. Can we see a presenter view or a regular view?
It looks like the regular view.
Awesome. All right. So I'll go ahead and get started, but I'll just introduce us. So hi, everyone. My name is Alex Gorey, and I've been working with my colleague Bao He, who will speak momentarily. But today we will be talking about just the video process that we were creating for these Hep B videos. So first off, I wanted to talk about the video storyboard process. So this was a really good way to begin this whole entire process. So we initially worked with an animator as well as a video producer to carefully map out the CDC guidelines and recommendations. This overall was mainly focused for a provider level audience. So it's a little bit more higher level than the videos that we created, myself and Bao. But we felt this was really, really convenient to show just the step-by-step process and a frame-by-frame process of what that looks like. So we got very, very detailed with it, getting down to the different types of graphics we wanted to use, the different language and how we wanted to present that. So this was a really great way to begin that entire process. In contrast with that, we decided to proceed a different route with trying to focus our language and messaging more towards a lay audience, in a community level audience. So I'll have my colleague Bao talk about that a little bit more.
Yeah, so after the production of this video that Alex is sharing with you guys, we went on to create 3 more videos for the public. And we decided to use the whiteboard platform to do so. It's a bit more text-based, but it really gave us the ability to create content within our ability and not have to wait for someone else to approve, like having the animator approve this and that. But we had the ability to create the content for the lay people. And so these 3 videos include like hepatitis B guidelines, living with chronic hepatitis B, and pregnancy hepatitis B and moms. And I'll have Alex play the pregnancy hepatitis B and moms video, but that will basically incorporate 5th grade level, and we voice overed these videos for the most part.
Here we go.
Yep. I don't hear the sound.
That was my fear. Okay, hold on. Let's see.
Making you have to click that little check mark every time. I feel like that should just be a bigger, like, hey, do you need to share sound with this screen share?
Yeah, let's see. See, Frank, where would I find that?
So when you go and hit share screen, and you're given the screen that lets you pick all your different screens at the bottom, there is a share sound or optimize for video clip. Just make sure one of those is clicked, and it'll make sure the sound is shared.
Okay, awesome. Let's see, I'm gonna reshare real quick. Apologies. Very odd. It's not allowing me to do that.
If it's publicly posted somewhere, we can play it that way.
Hey, Bao, are you able to open the file itself by chance?
Yeah, Frank, I was going to say, can I email it to you right now?
Yeah, absolutely.
Okay.
Thank you.
Thank you all for bearing with us through the text.
Appreciate that.
Yeah, because we definitely want to make sure folks can see this one. These are really exciting.
Okay, Frank, so I sent that over. It's in an MP4 format.
And there were some asks around if slides would be available, if we can share your slides later, and how we might be able to get access to some of those materials. Let me see, the MP4.
Bao, can you put your email in the chat for folks who want a copy of the scripts?
Yeah, definitely.
You can put Alex's too.
And that hasn't come through yet.
Alex, can you send it to me? On my bottom of my screen says I can share the sound.
Oh, you can? Okay.
Yeah, I can.
Okay, awesome. Let me send this over.
We all have what the other person needs. This is like the music, like musical chairs, or the find the balloon icebreaker. For anyone who's witnessed, like, oh hey, this is tech issues, just know that we've actually been having like HBF trying to talk to UC Davis has all day had problems. We've had like emails that just won't get delivered. So this, I feel like there's a ghost in the machine somewhere. And do we have any other materials we want to highlight as we try to pull this video up?
I can maybe interject with some as we're waiting. But I'd like to just point out the fact, I mean, these Julie, Alex, and Bao, they did a tremendous amount of work for these. I mean, so they look really slick and nice now, but they made them that way. And we even had to, like, during this time, we had to pivot because initially we were doing risk-based screening, but now so we had videos prepared for that, and then when the new recommendation came out, we had to switch. So this team has been amazing to make that change. It was not easy, so we've made multiple videos on this, so much credit to them.
I'm a little bit curious. You mentioned the whiteboard, being able to develop things within your abilities and not have to worry so much about outside help. That sounds like something that could be beneficial to the rest of us to know. So is it, can you talk to us about like kind of how that works some?
Yeah, definitely. So when we worked on the first provider video with the animations, that consisted of a producer and an animator, and we only had like X amount of edits, and they had cutoff times that we had to meet. They had cutoff times on like animation only versus scripting and so forth. So that was a huge challenge, especially because we worked as a team to get the script approved, to get the animation approved internally, and to communicate that over, and then to kind of hear the turnaround time on that too. It's like, all right, thank you for the edits, please wait another few days and we can come back to you guys. So it was just a huge turnaround process for the most part. So to be able to use whiteboard, it allowed us to go ahead and produce what we wanted to produce for the community and do it in a diligent time manner. But
Nice.
I did share with you, Julie, the MP4 format. It seems like it's been sent successfully.
All right. Yeah, Julie, it looked like you were able to share screen.
Yeah, but
All
now
right.
my sound clicking doesn't work.
Mm.
Okay, we can show it without the volume for now. And happy to drop the links to all of the materials. Really sorry for the technical difficulties. Let's see. Yeah, I can click on it, but then that box to hit like square share the sound is not, it's not working.
Is the voiceover script similar to what's on the screen, or is it
Yes, it
more in
is.
depth?
It is.
Okay.
You're just missing the nice music in the background.
There's a great question that just came in that said, how much did it cost approximately to create the video from the script to the final product?
I would say,
So
let me say that there was the effort by Bao and Alex were donated, as well as um, the instructor also donated that. So other than the personnel efforts, I think the cost of the software to do this is very reasonable.
Nice.
I would say that it's within everybody's budget. I don't know the exact dollar amount, but we can send that information.
But I think it was just a general, like, how accessible is using kind of this whiteboard technique for educating in a animated or video way. I know I'm very excited about it because I've seen it in like the business side, but this is a really cool way to do these. And you had two of them. Were you trying to share both? Are we thinking we're about to run into the same problem?
Yeah, we have yes. One
Although,
was
so
pregnancy and the other one was living with chronic hepatitis B.
Okay. Do we is it the same problem? Is there a way is the embedded file pulling from YouTube or from someone's like your computer?
it's embedded into the PowerPoint itself. It's just the audio button is not working. I don't know if it's because we're like panelists or what, but it's like disabled.
Got it. Okay. No, I checked on the back end here, and you should be able to have it. So I'm not sure why it's preventing that for you guys. Okay. Should we go through the other one, or do you want to talk about the your other white paper or whiteboard? Sorry.
So we might encounter the same issue. I'm for just leaving it as is. If you guys all are, what you've seen in this video contains elements that are found within the other two videos for the most part. But I'm a fan of the music playing and the voiceover. I think it really lightens up the videos, you guys.
Well, and let me just say, I apologize, I can't get on the video, but we have a actual video for primary care providers, and that was what Dr. Chak helped narrate, and unfortunately we couldn't show it, but the scheme, the strategy is to have this video for providers, which is about 2-3 minutes, and then for the different multi-language aids to accompany that by radio and by other means, and so that would help support a community-wide effort. At least that's our strategy. And then these two other videos, the one on pregnancy and moms and hepatitis B, and the living with chronic hepatitis B, they're both whiteboard things, and I would highly recommend that you download them and then hear them and see them for yourself, rather than trying. For us, we're having technical difficulties in doing this.
No worries at all. And really, I think we got quite a good look at we got like a tasty morsel at our buffet, and this is all you can eat buffet, so you can go back for seconds after this hour. We are down to the last 15 minutes or so, and I wanted to present two different pages on the HBF and HBU websites real quick, and then give folks a chance to answer some questions, because we did have a couple good ones and one we said we'd get to earlier. So first, I'm going to put a link in the chat, and this is to the Hepatitis B Foundation's press release right after the CDC released their guidance about the screening recommendations earlier this year. And I will share my screen. In that press release, though, is a link to this call to action. And I wanted to flag it during this webinar because it very much goes hand in hand with the video geared towards providers on implementing these guidelines. This is a call to action that is really goes through and looks at the different ways you can implement these universal screening and vaccine guidelines in your clinics or in your different settings. It was put together by just a huge panel or a huge group of 30 subject matter experts from across the field. My colleague Michaela Jackson spent a tremendous amount of time on this, and we released this as part of kind of the same work that you all are doing on making sure providers are able to implement these. So wanted to release that or submit that press release and link in the chat. I will link to the direct PDF. And then the other thing I wanted to share is that the Hepatitis B Foundation has quite a few in-language materials on its website. So I just shared the link to the website, and I'm going to share my screen just real quick. So hepb.org, I think we have the coolest web address in all the infectious disease land. Under resources and support, under fact sheets, we have some different pieces around like living with chronic hepatitis, similar things around that perinatal piece, in some additional languages. So one of the biggest things we've been hearing after more than a decade of being in existence and creating materials is the need for more in-language materials. So I don't think you can ever have enough. And we really just wanted to, in addition to the great ones that were UC Davis just mentioned, wanted to make sure folks were aware that these existed as well, just because a lot of folks don't realize that these exist, and I want to make sure they do, because having access to these in-language materials is important. So those were the two big pieces we wanted to make sure to highlight, kind of piggybacking on all the great things you just shared. Our question, though, oh no, okay. So what strategies are in place to inform and train partners to effectively carry out prevention awareness raising and precautions? So I wanted to say one of them is kind of these materials, making sure providers know what's happening and kind of what to do. But I was curious if, in addition to this the Comprehensive Cancer Center existed for a while, and you do more than just these kind of materials. In addition to these resources, what are some of the efforts you're working on to sort of marry these new recommendations and ensure that this kind of awareness and focus on hepatitis B can continue to exist?
Let me volunteer Bao, because Bao is actually going to implement a train the trainer approach, because she's bilingual Hmong and working with one of the FQHCs who has a lot of people at risk for hepatitis B. So Bao, you want to describe your strategy and your vision?
Yeah, I can do that. So, we talked about going to one of the FQs, the federally qualified health centers in our catchment area. And because there is a large Hmong population out there, and because that FQ does have staff members who speak Hmong, we did find that there were challenges to get their support on creating materials to benefit their Hmong patient community. And so looking ahead, Dr. Chen, we talked about how I would go out there and to come up with strategies to help that community, that patient community. And so I am going to do like a train the trainer model for their Hmong workers, and to kind of replicate like someone like myself as a health educator to do this work for the most part. And that will require me to, obviously receive buy-in from the Hmong workers there, but hopefully the end goal is to ensure that there is someone similar to me that can help out with cancer control and prevention, starting with hepatitis B, and then we will move to colorectal cancer screening. So I hope that gives you some insight. Did I capture everything, Dr. Chen?
Oh, yes. I'm sorry, I put you on the spot, but at least the premise is the fact that that there's never going to be enough trained health educators to do the job for every FQHC, and then my vision, I think because I got criticized before by the community I left in Ohio, that this community leader told me, "Hey, you did great, Moon, except you never trained a replacement. So when you left, the work ended." And so I've tried to pledge that I am going to try and find and work toward training replacements.
Yes, that you have touched on a essential sort of grassroots organizing or community building piece of making sure there are homegrown leaders. Certainly have seen, we have our partners being a coalition of coalitions. That has been something identified by actually very recently, we just put a survey out to our coalition leaders asking, like, what are you struggling with? And developing leaders was one of them. So certainly a struggle. Bao, you mentioned colorectal cancer. Dr. Chen mentioned earlier that colorectal cancer, helped get liver cancer demoted. Was that the reason for colorectal cancer being the next focus?
I'll ask Dr. Chak if he could comment on that, because he's both a GI specialist and a hepatologist.
There you go, Dr. Chak.
So the question was, is the next focus going to be colorectal cancer screening instead?
That's what I believe Bao just mentioned. It was, that was going to be the next step on the train the trainer. Is that reason because it has leapfrogged liver cancer as the #2 cancer killer?
Yeah, I mean, definitely. I mean, obviously I'm biased because I do colonoscopy and I'm a GI doctor, so I diagnose this stuff too often. But yes, I think that's definitely part of it. And so we do. I don't think we mentioned this particular project, but we are doing some work with colon cancer screening already, like in the community with FQHCs, with Ampla Health, and UCD. So yeah, I mean, we're definitely looking at any kind of preventable cancer. I mean, if you look at the main ones like breast, lung, colon, cervical, right? Those are the main screenable cancers that we have. And then liver cancer, of course, too. If we test people and we screen them for the disease early and we diagnose them, we can prevent cancer altogether. So yeah, I mean, I think any screen preventable cancer is fair game for us, and so we're really on board with trying to prevent any of those if we can.
Got it. Thinking back to something that was said early on in this presentation or in this webinar, and I forget who mentioned it, but that the materials were run by, or at least some of the materials were run by focus groups to ensure that it was like the proper language and said the right way. Were there any takeaways from those focus groups that surprised you that might be good lessons for the rest of us to know when putting together materials like this?
I will try that one. So I think for us, anytime we develop new materials, we do want to run them through at least focus group or key informants with the community members. And I always learn something new every single time I present materials to them. When I like Dr. Chak was the one who did the original messaging, and then the team tweaked it a little bit, and then we ran it through like health literacy program to make sure it's at the right level. But for us, even when I did it at the 5th grade level, it's still some of the words still were hard for the community to translate over. So I think we did a lot of describing of things instead of saying the medical terminology, because some of them don't exist in the various languages. So we described what it looked like, we described the color, and then we mentioned the word afterwards. So that's a lesson learned for me, that even though there are words that are translated, I can say liver cancer in Vietnamese, but I need to describe it. So every single time we introduce a new medical term, we try to describe as best as we can. So that's one lesson learned. And another thing about doing these focus groups is like, you never know what you're gonna get. Like I think a picture looks really great, and then they will tell me like, oh no, like the color is wrong. It has to be 5 different colors, not one color. So I think it's just really important that you do these focus groups just to get the color correct, and then get the terminology correct. And I think now I'm aiming for like a 2nd grade reading level for some of the
2nd grade. Okay. Wow. Let me write that down. Because language access and reading level, very important materials, but
and we switched a lot to like infographics as well. Some of our lots of infographics. That was one of the key messages that I got from our community members, that they want to see a step-by-step in an IKEA manual type way. Like you can look at IKEA manual and just look at the photos and you can follow the instructions. You don't even need to read the words. So they told me, if you can get it to that point where I don't even need to read anything and I can just follow the pictures.
That is fantastic. I don't think I had ever considered that. Well, and except for like we have comics. I know that we have comic strips. I'll try to pass those out as well. With our last 5 minutes, and we try to always end a few minutes early. Just wanted to see if there were any last pieces, either like calls to actions, hurrahs. Make sure to share, largely and widely, that each of you wanted to go with. So I'll kick it off with Dr. Chen, and we can go. I'll let him decide who to pick on next.
Well, first of all, thank you, Frank, and thank you, Hepatitis B Foundation, for this opportunity, this privilege. I really see this as one of the great opportunities to really eliminate hepatitis B as a cause of liver cancer. I mean, the fact that we've demoted it because of the community-wide participation and how many groups have chosen to focus on screening, and also to have universal hepatitis B, infant vaccination, and having that through. I mean, it is a tremendous model for eliminating a disease, and so that's the exciting thing. I don't know, Eric, you want to add anything?
Yeah, I would say for me, absolutely. And I agree with what Moon was saying. I think my parting shot, I guess, to everyone would be, don't underestimate the digital approach to outreach. And the pandemic has made us realize that we can do Zoom, we can do video visits, we can do a lot of stuff, and you can send, and we've done this and we have experience with this, you can send educational messages, videos, just like the ones you've seen today, to thousands of people at one time, even more, just electronically through EHR. You can put it on a website, like you have, Frank has mentioned too. So I would say, don't forget that, we don't have to do this one by one. Of course, that is very effective, seeing a person one-on-one and doing that, but using social media, digital health, I think will accelerate our ability to eliminate Hep B, as Moon is saying.
I guess my parting message is if you notice our buffet of materials, it's multi-level. So we have materials aimed at community members, patients, providers, medical assistant. So I think it's very important to have a multi-level, multifaceted approach that resonates with each one of these different groups. And just to make sure that you partner with community clinics and health centers to make sure that we can show the impact of all of this work that we've been doing.
Alex or Bao?
Yes. Okay, I'll go, Val. Yeah, so parting words, I would just like to say doing this work and working with Val collaboratively to get this message across. It worked really well, and just going out, as you saw in the pictures that Julie was showing, flyering out in the community was really enjoyable, and just having folks being receptive to wanting to learn about this new recommendation, I think really just set the tone for what's to come in the future. So thank you.
I was going to say that, by displaying the whiteboard videos, it's just a powerful tool. And, Alex and I created this for English. I mean, imagine all the possibilities of this tool being used in multiple languages. So take advantage of that.
Awesome. I will say to everyone, please share your resources far and wide, the ones that you make for your personal little organization or community. Because actually that's how this webinar started. So first off, I'm going to say Hep B United is our coalition. I shared some Hepatitis B Foundation links earlier, but this is our coalition. So if you are doing this work on the ground, please come on and join our coalition, and so that it's free. We can help with capacity building in a lot of different ways, but we really use our listserv to pass around these materials. And it was an email back in late June or sometime in July from UC Davis with these materials that we came across, and we're like, these are awesome. And just a back and forth with Moon led to this webinar. And so, people create these materials to have an impact. And so if you have your own materials, we're happy to promote at Hep B United. And if it's, really, really cool like this, we'll have a whole webinar about them. So really appreciate the entire UC Davis Health Comprehensive Cancer Center. That is a mouthful. For coming on. This has been recorded. There's been a lot of information shared, so we will try to share out some of the materials as we can, as well as the contact folks, the information to contact them to get their resources. And as always, we hope you tune in for our next webinars and other capacity building. And if you have any questions, don't hesitate to reach out. So, thank you, everyone. Have a great rest of your Monday.
Thank you.
Bye.
Thanks for having us.
Thank you.